A very warm welcome to Global Healthcast COVID Special, a co-production between Global Health Press and the Coalition for Life Course Immunization, CLCI. This podcast was made possible through an unrestricted grant from Novavax. Our 6 COVID specials will cover epidemiology and surveillance, long COVID, COVID in children, vaccines and vaccination. I am Schmitt, and with me throughout the 6 COVID podcasts is Professor Catherine Weil-Olivier in Paris. Hello, Catherine.
Hello, both of you.
Our topic today is COVID-19 vaccination in peacetime. It is our great pleasure and honor that for this topic we have with us as expert Professor Luigi Lopalco. Hello, Professor Lopalco.
Hello everyone.
Professor Luigi Lopalco is a medical doctor and a full professor of hygiene and preventive medicine at the University of Salento in Italy. He's a specialist in hygiene and preventive medicine, and he is an internationally well-known top expert in prevention and infectious diseases and in vaccination programs. Professor Palco has been working with the ECDC from 2005 and 2015 in Stockholm, and he was leading the program on vaccine preventable diseases. Since 2016, he is back in Italy, where he's currently a full professor at the University of Salento in Lecce. Without any further delay, thank you very much to both of you for joining today. And let's start with the first question to Professor Lopalco. What is the difference between the situation when COVID vaccination came up very initially as an emergency license and today, autumn 2023?
Oh, the difference is huge. I think that we have experienced something that was never seen in the history of vaccination. We really saw a race for vaccine. It was amazing. It was amazing. During an emergency, we got several vaccines that were working very well, were deployed to the population, and there was a huge effort from public health and from the government to cover as much as people as possible in a very short time. And that is the huge difference. We were in an emergency. So there was a very strong offer from the governments, from the public health sector. And on the other side, there was also a great demand from the public. People was scared about COVID-19. And there was a huge demand. At the very beginning, actually, the demand was even stronger than the capacity to provide vaccination. So people was really eager to get vaccinated. This was the emergency. And the situation now is completely different. Unfortunately, the demand is lower because people is no longer afraid of getting this kind of infection. And unfortunately, also the healthcare systems are investing less in the vaccination program. So now in peacetime, we really need to reinforce the importance of this vaccination in order to get it very, very successful as it was at the beginning.
Luigi, if you allow me, I have a question, because during the emergency period, the vaccines were bought at the level of Europe for all countries. Now on, is the situation totally different? Is it bought country by country?
It is for some countries. I can tell you the situation in Italy. We are still taking advantage of the central procurement procedure, so of the European purchase. That is also the reason why we don't have all the vaccines available in Italy. But we have those vaccines that are one mRNA and the other is a protein-based vaccine that were purchased at the time of the emergency through the European procurement. So that contract at the European level is still valid for us in Italy.
Just let me remind the audience that you were a strong promoter of during pandemics buying collectively those vaccines, and the experience come from H1N1 2009. And so I know you were strongly in favor of buying it centralized in Europe.
It worked very well during the emergency. Otherwise, the countries would never ever had so many vaccines available in time.
Yeah, and the trend now on is to consider that it is a respiratory disease, mostly during wintertime, as it is for influenza. And for maybe simplicity, governments are treating the boosters for COVID vaccines as similarly as an influenza vaccine. Do you really consider that it is a seasonal disease now on, or should we, for some specific population, more priority population, go to boosters twice a year?
You already said that this was a practical choice. I mean, we have to be pragmatic.
Yeah.
I agree that for highly susceptible populations, maybe a couple of boosters in 1 year can be more safe. But on the other hand, we must be pragmatic, and we know already that a seasonal vaccination is not easy at all. We know that implementing influenza vaccination is not a joke. It requires a lot of resources. So I think that even though COVID-19 is not yet perfectly seasonal, is not perfectly synchronized with the season, with the autumn, winter season, I think that the best option is still combining this vaccination with the influenza, and therefore set up a seasonal vaccination campaign.
So would you foresee that WHO gives strain recommendations every February or maybe even every August, right? To be as close to the season as possible in the Northern Hemisphere. How do you have any idea how that may work in the future?
I mean, the regulatory bodies like FDA and the EMA in the US and in Europe already went in that direction to tell the companies to be ready to get the information about the strain and therefore to provide a vaccine more or less the same way as we do with influenza. So yes, I think that the coming future is going in that direction.
And so going back to the vaccines, we know that for the season coming, it is a monovalent vaccine based on XBB.1.5, and it's quite different from the new original vaccine. It was a bivalent, including Wuhan strain, spike protein. So do you think it's the way to go forward, and every season we will have new strain as close as possible as the last variant identified and circulating?
So far, we saw that SARS-CoV-2 really is circulating with a unique strain. I mean, the strain replacement is very quick. And in few weeks, all over the world, we see just one predominant strain. So I think that this will be, for the coming future, the approach. I mean, now also don't need the bivalent vaccine for the simple reasons that most of the population already experienced either one natural infection with one of the strains that were circulating in the past, or they were already vaccinated. So I think that at this point, when most of the people already experienced some immunological priming, either with the virus or with the vaccine, I think that a monovalent vaccine is the best option.
We start seeing some data about immunogenicity with the new vaccines against different strains and even the strain circulating. So we need to reassure the population that first it is useful, and we need to reassure the population because many of the people, as you said, have been infected once, twice, or even 3 times, and they wonder if they will get the vaccine. So what would be the main message here to convince the people to get the vaccine and the booster?
I think that the main argument is that we can be infected several times in our lifetime, and several times even in 1 year. We can get infected even a couple of times in 1 year if we are not protected. So protection against this virus is important, because the fact that I got an infection few months ago and that infection did not got into a severe disease doesn't mean that next time I can have a more severe infection. And don't forget the problem related to so-called long COVID. Long COVID is a reality, is something that can affect people that have been infected several times. So the more we get infected, the higher is the probability to get a long COVID in the future. So protecting from the infection means also protecting against severe disease and long COVID.
The only practical point would be to, if you have been infected, wait for at least 3 months before getting your booster, because you have re-induced your immune response with the infection. And so maybe you can wait some weeks, and it's better to wait for 3 months at least.
That is a very practical advice, that either an infection or a previous booster given during the previous 3 months is enough to be protected.
Yeah. So as we are very practical here, we know that some priority groups should receive the booster, and we have to trigger their interest. So would it be simple to say that those priority groups are absolutely similar to those for influenza vaccines?
Basically, yes. The people that usually have been advised to get influenza vaccination are the same that now should get COVID vaccination. Remember that the most important risk factor for having a severe COVID is age. So the older, the more urgent is to get vaccinated. On top of this, we should remember vaccination for healthcare workers, pregnant women, and all people, independently for the age groups that have some underlying condition, like obesity, diabetes, kidney disease, heart disease, pulmonary disease, the same problems that usually are considered for advising for influenza vaccination.
Actually, in the United States, the recommendation is for universal vaccination. Would you happen to know the rationale why in the United States the goal is to vaccinate everybody?
I mean, this is also going in pair with influenza vaccination. Don't forget that in the US, influenza vaccination is also recommended to everybody. On top of this general recommendation, of course, there is a priority recommendation for those groups that we mentioned before. So the flu vaccination, as well as the COVID vaccination, is useful for everybody, but there are some priority groups. So in the US, they have a very pragmatic approach because they sum up all the risk groups. And at the end of the day, they say that, oh, it's almost everybody, because you sum up all people over 60, and therefore you sum up people with obesity. Don't forget that in the US, obesity is a social problem. If it's not just obesity, but you put also overweight, we are talking about 70% of the Americans. So it is, again, it is a pragmatic choice not to be so strict with the recommendation, but to get a broader recommendation, very simple to understand, that this vaccination is useful for everybody.
Mm-hmm.
Yeah. Let me ask one question with regard to the vaccines. I got my 5th dose a week ago, and no big deal, right? I didn't even notice. In the end, the big question that people ask now, and as we see legal cases coming up, I guess across Europe, it's the same in all countries. Can you elaborate a little bit on the real side effects? Not any myths or people come up with all stupid things, but what are the real worries when it comes to the safety of the vaccines that are used in Europe?
Nowadays, we are basically using 2 vaccine platforms, the mRNA platform and the protein-based vaccine. We call it the traditional vaccine, is a protein-based with adjuvant. So both vaccines are vaccines that have been used now very, very extensively. There are billions of doses of these vaccines that have been distributed worldwide. So we are sure that there are no rare or unexpected serious adverse events coming from these vaccines. We are sure about that. So what we just should know is that this vaccination, the same as other vaccines, can provide some common adverse events. That is eventually fever, it's pain, it's some weakness, headache. I mean, are those common adverse events that are very common and usually are lasting not more than 48 hours, usually last for 24 hours. So it's a 24 hours, let's say, discomfort following vaccination that in any case, it's a good, let's say, assurance against a severe disease. So I'm very confident to say that the vaccines that we are using now in Europe are among the most safe vaccine products that we ever used.
Yeah, and to emphasize what you just said, I was astonished by the quality of the pharmacovigilance in every place, every country, every continent. And we knew week by week what happened with those vaccines. So I am totally online with you when you say that those vaccines are safe. They have been surveyed so strongly and permanently with their large usage that really we must consider that they are safe vaccines. There is one point we haven't evoked, that the co-administration between flu vaccine and COVID vaccine, both are inactivated. And I should say that for any catch-up, individual catch-up, we can co-administrate inactivated vaccine on the same day. I am thinking of pneumococcal conjugate vaccines or any kind of vaccines.
Yes, I mean, the same as other vaccines like pneumococcal vaccine or zoster vaccines that are usually co-administered with the influenza vaccine. COVID-19 also can be co-administered. That is a very useful option. One in an arm, the other one in the other arm. Absolutely. And it doesn't increase the rate of adverse events.
Absolutely.
On the contrary, being just one vaccination if you have to have some discomfort, you get this discomfort once and not twice with two different vaccines.
That's right. That's right.
Yeah. Very good. I guess coming close to an end and looking ahead, in your view, what will be the biggest challenges ahead with seasonal COVID-19 vaccination?
I'm just a bit worried for this season, because now we are suffering of what we call vaccination fatigue. Vaccination fatigue is some sort of things that people just says, oh, please, I don't want to hear about vaccines. Please don't talk about vaccines. This is people, but vaccination fatigue is also affecting healthcare workers. Healthcare workers are very tired. They, during the emergency, they worked a lot. They went under stress, and the whole system was stressed. So I think that this stress in the system is still there. So I hope that during this season, we will have a good vaccination demand, and therefore, coming from next year, it will just become something, let's say, usual, like the seasonal influenza.
Yeah,
Excellent.
I guess the combination will very much help, right? And also the barriers have to be reduced. I'm in the US. I was in the US quite often in the past, and there, your flu shot is given in the pharmacy, in the drugstore, right around the corner. You do your shopping, you get your shot, you go home. That's it, right?
Joe, excuse me to interrupt, because we do that in France. I must say it's very convenient to go to the pharmacist, you push the door, you have your vaccine, and you go back.
Congratulations, yeah. Pierluigi, how is that in Italy? You had that?
Yes, we just started. COVID-19 was the good opportunity to start vaccination in the pharmacies, because we had to make it very quick and easy. So I hope that also during this season, we keep this habit, and then we still continue to vaccinate in the pharmacies.
That was a very good conclusion in the end. Thank you very much. This was our Global Healthcast COVID special on disease and vaccination with Professor Lopalco. Today, September 28th, 2023. Please like, share, and leave your comments below. Thanks for joining us today. Stay safe and get your vaccines. I am Joe Schmitt.
I am Catherine Weil-Olivier.
And I'm Luigi Lopalco.